Be mostly sunny, going up to a high of 71. And welcome back to the most news in the morning. As the healthcare debate heats up on Capitol Hill this week, every day people are faced with real-life implications of a fractured system that we have today. New York Times columnist Kristof brought us one of those life-or-death decisions in a powerful column titled "Dad's Life or Yours." It's a story of a father who desperately needed a kidney and a son who wanted to save Dad in a system that they claim prevented that from happening. Joining us now is Kristof, along with one of the subjects of that column, Travis, and David Waddington, your father, also is going to be joining us. There he is. Welcome, all of you. Thanks so much for being with us. Kristof, by the way, is also the author of the new book, Half the Sky, about the oppression of women in the developing world. Great to have all of you with us this morning. Let me just start off with you, Nicholas, because you've been writing these columns about people's heartbreaking stories as they struggle, as we said, to make these decisions about their health, needing to weigh the financial implications, the costs, the lack of insurance. What have you learned from writing these columns?
Well, I mean, at the end of the day, we know that our present health system costs about twice as much as those in other countries and underperforms. They have way worse health statistics than other countries do. And that about 45,000 people die a year because they don't have health insurance. But all of that, I think people kind of glaze over. I think what really matters and moves people is these individual stories, people like the Waddingtons, who were forced into these impossible situations because of the existing health insurance situation.
And let's talk a little bit about this situation that you were in. And David, I want to ask you about it. You have what's called PKD, which is known as polycystic kidney disease. It's a genetic condition that caused both of your kidneys to fail. So when your doctor told you that the best match would be a family member, you have two sons, one of whom is with us today, Travis. What went on in those discussions in your household?
We're looking at the side effects, how does it impact the sons? And the position has always been that you're better off not knowing. Since it's an untreatable disease, you look out for the symptoms. The worst, it can cause problems obtaining insurance. I've been denied for supplemental insurance, and there's a lot of respondees to Mr. Kristof's column who've had problems and concerns with insurance as well. Since it's untreatable, you treat the symptoms, and which is high blood pressure and pain as it occurs. So.
Right, and we should point out that, I mean, thank goodness in the end you did get a donor kidney. It was not from somebody in your family, but your son's here with us. And Travis, when you found out that your dad had this and that you and your brother Michael have a 50-50 shot of also having PKD, what was the biggest debate? What were the biggest challenges in trying to find out whether you could even donate to your dad and whether you were able to do that?
Well, when we had this discussion, when we first learned about it, the whole family was there, and Mom and Dad explained the situation to me and Michael. But I was surprised that there wasn't really talk about the possibility of donation. I figured, all right, maybe our parents don't want us to, don't want to ask this of us or whatever. But my brother and I sat down and had a conference just between ourselves and decided that the only possible thing to do was for us both to get tested. And hopefully, 25% shot, neither of us would have it, and then there would be no question that we'd be able to donate to our father. We presented this plan to our parents, and my memory of it actually is that Mom was kind of angry. They firmly shot it down. I think they were upset that we were not seeing the big picture.
Right, and Nicholas, you can explain this too. If either one of them got tested and then it was on record that they had this pre-existing condition, they would either be dropped or couldn't get insurance.
Then they might forever be unable to get insurance. And so I think the parents, to their credit, were alarmed that Travis and Michael might, by trying to help their dad, lose the possibility of getting insurance.
And so where it stands now is that you did not get tested.
I have still not gotten tested.
And this is not because of your own health, it's because of
no, I mean, it's clearly irresponsible from a health point of view, right? I'm not medically capable of really monitoring my kidney's health. I'm just sort of waiting to see side effects, which without a doctor is kind of stupid. But it's what the doctors in the field who treat PKD strongly recommend is that I do this, which,
I mean, it would make so much sense for Travis to get tested from a medical point of view. It might help save his life. But if he does get tested and finds that he is carrying PKD, then he will be unable to get insurance to get that coverage because he needs it. And that is precisely the problem with the existing health insurance system.
I think that a lot of people agree that it's broken, and I mean, this is an example of where people slip through the cracks, and, you know, they're not alone. As we've said before, there are 45,000 people who die each year, not because they don't know that they're ill, but because they can't get help. But as this big debate goes on in Washington, it's not a no-brainer for a varying number of reasons. Right. People disagree that we can afford it. So what do we do about the cost?
Well, you know, I think that one of the mistakes that advocates of universal health coverage have made is they focused on the technical issues. They focused on the question of productivity, the economic impact, the economic cost. And fundamentally, this is a moral decision. And in those other countries that have embraced this policy, it has been because it's been a starting point that we don't want people to slip through the cracks and die because they can't get insurance under the existing system. So I think that is the starting point, that this is something that we cannot tolerate morally.
One of the criticisms, though, has been that there's like 90% that everybody agrees with, that you shouldn't be dropped for pre-existing conditions, that people who are uninsured should have the option of getting some sort of basic coverage to help out, that we should electronically make the medical records easier and streamline them. But because of the larger debates on certain issues that no one's going to eventually agree on, no health care is getting passed.
And that has happened, you know, for decades now. I mean, this is something that FDR initially wanted to have as part of Social Security. I just came across a 1919 magazine article that was complaining about the lack of universal health coverage in the United States. Hopefully, this will end this year.
All right, you're optimistic?
I am. I really am.
We'll see what happens. But meanwhile, we wish you the best of luck. And David, how are you doing, by the way? As we said, you did get a transplant, a kidney transplant from a donor. How are you?
My health is the best it's been in a great number of years, and organ donation is and transplantation, and even dialysis itself are gifts of life. They're truly modern miracles.
You're absolutely right. Well, we wish you the best of luck, and we also wish you luck, Travis, as well as your brother, who was, by the way, tested and diagnosed with PKD.
Right, just recently.
All right. Well, thanks so much for joining us this morning, all of you. Nicholas, your columns are great, and you have a very, very good perspective. I'm glad we had a chance to talk to some real-life people and find out more about what's going on out there.
There are an awful lot of them out there.
Thanks. John?